it is better to buy milk than to rear a cow. You know, that's a very common Kenyan saying, that it is way cheaper to buy milk than to rear a cow. If you rear a cow, you will cut napier grass, you will have to make a place for it to sleep, you will have to attend to this cow, spend all your time and money on this cow so that you can just milk, okay? And somebody else may not spend on this cow, but when you have just tied it somewhere, he will come and milk the cow. Right? So the reasoning of Kenyans is that it is better if you can just buy milk and then avoid rearing the cow, because rearing a cow is very expensive. Now, I understand people who say this because, anyway, to say the truth, it is very expensive to rear a cow. And for those who don't know, a cow in this context is a lady. And so if you keep a girlfriend, it is very expensive to keep a girlfriend, by the way. You have to spend your money on this girlfriend. You have to take her out. You have to attend to her emotional, physical needs. You have to spend your money and effort to make this girl happy. Then there's another dude somewhere, especially these bad boys. He will just come, he has no money, he's broke. Then he will take your girlfriend and then sleep with her. So guys assume that the better option is not to have a girlfriend at all. That the best thing to do is just to buy milk. That means that give her money and then she gives you things. And then you enjoy her things. Now, that is a very dangerous position to be in. You know, I'm working in a village setup, and when you reach a place like this one, it's usually very dark, but very calm and quiet. You see a path like that one. Very quiet, very calm. Then there's a shed on top there. Yes. So we are on this topic of rearing a cow and buying milk. Now, some of us have been against that philosophy, and I've heard some people tell me that, Gidi, don't behave like a simp. You have one nighties. That is why you have to stick to one woman. One nighties, you all know what one nighties is. Being obsessed with one woman, and you believe that there can never be another woman. So they tell me that I have one nighties. I am a simp. That is why I only want to stick to one woman. That I should buy milk. I should not rear a cow so that I can enjoy. Now, you people think that I'm only relying on my religious principles to say that a man should only have one woman or no woman at all. My philosophy also stems from my background in healthcare. You see, there's something a lot of young men don't know. A lot of people out there are infected with different diseases. And when we talk about infections, we are not talking about HIV. You know, when we talk about infections, some of you only focus on HIV. It's not HIV alone. We are also talking about many other diseases like gonorrhea, like chlamydia, like genital herpes, like human papilloma virus, like hepatitis B. There are so many. We learned about them in school, and we learned about how these infections affect people. And so if you have this philosophy of buying a cow, you must beware that you are putting yourself at risk of these infections. And as I have said, a lot of young men out there, they don't know the dangers they are putting themselves into. You need to be in a hospital being treated for HIV to understand that a lot of people have HIV. You need to go to a gynae hospital to be treated for human papilloma virus to understand that a lot of people have these infections. It's just like these motorcycles. When you are on the road, you see them being driven in a very bad way. Somebody's riding a motorbike in a very terrible manner. When you go to hospital, that is when you find people with fractures. A lot of people with fractures, they were involved in motorcycle accidents. That's when you realize, taking a boda that is being ridden in a very bad way, it is very dangerous. You see, in fact, in Kakamega Hospital, we have just one ward that is set aside for people who have motorbike-related injuries. And so when you reach there, that is when you understand that you should take a motorbike that is being ridden in a very good way, okay? And so I'm coming back to this healthcare issue and the issue of rearing a cow and buying milk. You know, you can feel very good that you are buying ladies, that you are not attached to any lady, but every new lady you sleep with gives you a chance of getting an infection. And a lot of people are getting infected every single day. Bro, we have a million new infections every year. A million. These are a million people globally being infected by STIs every year. And you could be one of them. You could be one of them. Some of them are curable, some of them are incurable. So don't underestimate the number of people who are getting infected. And by the way, diseases like herpes simplex virus, when I talk about 1 million every year, it has been happening every year. And a lot of people are living, and every year it's a million adding to a million, adding to a million. So you find that people with gonorrhea are millions and millions. For example, people with herpes simplex virus, we have about 500 million people on the planet with herpes simplex virus. And we have so many other diseases, millions of people, tens, hundreds of millions with these infections. And so every time you buy milk, every time you go to buy a lady, you are putting yourself at risk of getting these infections. And some of you underestimate these infections because maybe you got gonorrhea, you were treated, then you recovered. Then you got chlamydia, because it is simple, you are treated and then you recovered. Then you got another one, you are treated and you recovered. One day, somebody will give you herpes simplex virus, my brother, and there are many of them with it, and I know some of them are watching this video. One day you will be given that infection. You will stay with the symptoms for 5 good years before your body can develop immunity. You will think that this thing, you'll stay with it forever. Before you get a lot of advice from other people, you will have infections almost every time. You just finish the dosage like these symptoms. You finish the dosage like these symptoms. You will stay with those symptoms for 5 good years before your body can develop immunity against those infections. And that's when you will understand that it is very costly to buy milk. And some of you will get human papilloma virus. And then that's when you will understand that, so my thing can have cancer. You will have cancer of that thing. And that's when you will realize, so this thing could also bring cancer. Some of you, some ladies, you will find that you cannot give birth. You cannot give birth because you had an infection. An infection without symptoms. And then that infection led to infertility. So you see, the philosophy of buying milk is a philosophy that I understand. It is a good philosophy if you want to reduce costs and the emotional baggage related to relationships. But buying milk is a bad philosophy. If the idea is to stop rearing a cow, if the idea is to stop spending money on women, then you would rather have no woman at all. Practice celibacy. Have no woman at all. Just decide and have no woman. Or have one woman and pray that woman should not have diseases. And that is why some of us healthcare providers recommend, we don't force people. We recommend that before you start a relationship, kindly take this person to a healthcare facility, let the urinalysis be done, take their blood, test it, and then know your health status. I'm not saying that you stop dating sick people, because I know that is profiling and people will say that I'm causing stigma with this video. There are people who are sick and they are okay with dating sick people. There are people who have a virus and they are okay with dating people with a virus. And so the good thing here is to know your status. Go to a hospital, let urinalysis be done, let there be known that you have this condition and I have this condition, and so let us decide to be faithful to one another. Now, there is a catch to that. A lot of people lie that they will be faithful, but they will not be faithful. A lot of men out here are cheating. A lot of ladies are cheating. So nobody should lie to you that they are promising to be faithful and they will be faithful. No. Anytime people get a small chance to cheat out there, they do cheat, actually. They do cheat. A lot of married women are cheating. A lot of husbands have side chicks out there. And when they have a lot of side chicks and they are cheating all over, they are putting themselves at risk of getting infections. And when they get these infections and you are their main partner, they bring the infections to you. Okay? So everybody is at risk of these infections. But what I said is that I recommend that before you get into a relationship, test. And then when you find that this person has no disease and you wanted a person who has no disease, then decide that you want to be faithful to one another and better be faithful to one another. But when we start the idea of buying milk and then we stop rearing cows, it's a good philosophy for social media, but it's not a good philosophy for you as a person. Okay? Some of you who have not been in a healthcare class, you think that you will have a disease and be treated, or somebody who has a disease has symptoms. In the past, it is only when you could see, for example, I'm giving an example of HIV because that is the disease that we know a lot. Some of you know a lot. In the past, when somebody had HIV, it was easier to see. When it advanced and went to stage 4, you could just see somebody losing weight and then they would die. But right now we have antiretroviral therapy. People undergo ART and they live a very healthy lifestyle with the virus. So we have seen that actually somebody can have HIV and they are very healthy and you will not know. You will not know. Now, leave alone HIV, because HIV you can go to hospital and then when you test, you will find that they have it, only that they have known how to manage it. Now, what about other conditions like chlamydia? Like, by the way, young men, do you know that a lady can infect you with an STI and she doesn't have symptoms and she will say that you got that STI from another person? Did you know that we have ladies who can infect you with an STI, bro? I'm repeating this. And you will think that this lady does not have a disease, that I got it from somewhere else. And you will start blaming yourself. My brother, conditions like chlamydia, when a lady has it, they don't show symptoms. A condition like gonorrhea, when a lady has it, they don't show symptoms. They are just okay. Like herpes, like a condition like hepatitis B. When a lady has those conditions, she cannot have symptoms. She's just there. And you are there. You know, it's very easy for a man to have symptoms, because when you just insert inside there, then you get out, then you will experience urination is a problem. Then when you urinate, you realize, oh, it's painful. That's when you'll notice, oh, I'm infected. But a lady will just live like that. That is why I talked about infertility. Some ladies actually are now becoming infertile because they don't even know they are infected. The infection is rising up to the fallopian tubes and it will destroy the fallopian tubes and they will not manage to get pregnant. But they think they don't have that infection. And how did they get it? They got it because they were also buying milk. You know, you think you are the only one who is buying milk. Bro, you think you are the only one who is buying milk. These ladies buy milk with their bodies, not with money. They don't give you money. They are the ones selling. So she will sell it to you, will buy, then she will sell to another person. So if you are the one with an infection, you will give her and she will give to another person. If she went to another person and that person gave her the infection, she will come right with it and then give it to you. Then you have it, right? The only advice some of us can give you from a religious and healthcare perspective is to have one relationship. Not because you don't have nyege, not because you don't have it. Bro, some of us desire to have women. We desire. Like me right now, I desire to have a woman. Bro, I desire. But you tell your mind that I don't want that thing right now. It is you telling your mind, because it is your mind that wants. Your body wants, yes, but then it is your mind that is compelling you, go get it. Tell your mind that because of the illnesses that are out there, and because of my dignity, you know, dignity is religious. So, and I said, let's leave religious alone. Let's focus on the healthcare perspective. Because of the probability of getting an infection out there, I am not going to sleep with any woman. And then I remain like this. Not because I cannot get a lady to sleep with. Not because I cannot. You see, there are friends I was talking to, and then they were telling me that their body count is 100. Bro, there's a guy who doesn't even remember how many ladies he has slept with. You know, I was looking at that thing and then I was like, what? You know, you slept with 1, 2, 3, 4, 5, 6, and then you reached 100 and then you lost count and you are still continuing. Bro, the probability of you getting an infection is very high. I am sure, first of all, you have treated a lot of STIs. I am very sure from a healthcare perspective, I am a healthcare provider myself. I have treated STIs. I know. If you tell me that you have slept with a lot of ladies out there, then I know the next thing you want to tell me is that I have treated a lot of STIs. I know. If you have not gone to hospital, you have probably asked your friend who is a healthcare provider that which drugs can I use? I feel like something is burning. Which medication can I use? My friends ask me that a lot, and then I prescribe medications for them. Now, when you meet them bragging how they have ladies here and there, when you meet how they brag how they can easily bag ladies, you think they are heroes. They are heroes in terms of getting women. But then again, when it comes to diseases, now they come to me. Gidi, which medication can we use? Then I prescribe norfloxacin, I prescribe doxycycline, I prescribe fluconazole if maybe it's a fungi. I prescribe so many other medications, ciprofloxacin, for them to treat their STIs. Once they finish treating them, they again go back to their old habits. They go to look for ladies, and then they go and then get infections. So they are treating a cycle of infections, and that one is not very good for your reproductive system. The best advice I can give you from a healthcare standpoint, not from a religious standpoint, have one woman. And if you cannot have one woman because of the obvious risks that I've told you, because of course you can have one and she will cheat. If you just want to eliminate some of these risks forever, you can decide and then say, I don't want these women. Let me just be like that. Okay? Stop the idea of saying that I want to go and buy milk. You can buy milk that has bilharzia. You can buy milk that has other bacterial infections, and you will be infected, bro. Stop this idea of you cannot rear a cow. You know. And then we have these guys who usually say that kwani ugonjwa ilikujia nani? That disease came for who? That disease came for human beings. Who do you want to get that disease? That disease came for us. You've heard that. You've heard people saying how that disease came for human beings. It did not come for chicken. It did not come for cows, like a cow that is in the background there. My brother, I want you to listen to me keenly, especially when it comes to the treatment of these infections. When you say that this disease came for human beings, do you know the burden of treating some of these diseases? Some of you underestimate the treatment of some of these conditions. Like, for example, let me take just HIV. Sorry for using HIV a lot, because it is a disease that a lot of people know. A lot of people are infected with that. You have to take ART every single day. Every day, every single day, you have to be taking a tablet. Now, imagine when you have malaria, you start disturbing people to take drugs. When you have just a simple infection, even a common cold, you start disturbing people. When you are told to take a small tablet like cetirizine, you don't want to take it. But now you have HIV, and you are told that now you have to take this bigger tablet every day. You have to be disciplined for you to be healthy. You are underestimating that. Kindly call a person with HIV and ask them. Kindly ask them. How many of you go to a healthcare facility and ask nurses how many people are defaulting on these medications? A lot of people are defaulting. It is just that they are forced, they are compelled that take this medication for you to be healthy. Now they have no option. They have to take that medication. Now you are underestimating that, right? If you are underestimating that, I would like you to ask a person with another condition that people take medications a lot is HSV, herpes simplex virus. And especially the one that is very notorious and symptoms are coming all the time, then you are told to take suppressive therapy. And suppressive therapy for that condition is you take it for 6 months or 1 year. And you have to take medications like acyclovir every single day. Every day. And that one is BD. It's not like HIV, the one that you take 1 tablet per day. That one you are taking morning, evening, morning, evening, morning, evening for 1 year, so that you can suppress that virus, so that the immune system of the body can work well. Now, can you take medications for 1 year, morning, evening, every single day? When you say that this disease came for human beings, this disease did not come for cows. Also, remember that there are human beings who are suffering out there treating these conditions. You think it is easy? And I'm talking about only maybe taking medications alone. I'm not talking about the cost of buying these medications. I want to thank the government because it is giving these HIV medications for free, and people now are having what we call undetectable status. When people are undetectable, they cannot transmit the disease. And so the government is playing a very big role in reducing the infections. That is why you see that a lot of people now are not spreading HIV. But when you get other diseases like herpes, you need to buy these medications from your pocket every day. There are some places where I've had a chemist that I've sold drugs, so I know some of these small chemists want to inflate the cost of drugs so that they can make profit and pay rent, pay workers and all that. So you will find somewhere they will be selling you a single tablet for 40 shillings. Single tablet. In my chemist, I was selling it for 20 shillings. But then in small chemists, you will be getting this medication for 40 bob. Now imagine this is 1 tablet 40 shillings and you have to take 2, that is 80 shillings. Now 80 shillings every single day for 30 days, that is 2,400. Now 2,400 times 1 year, you see that is like nearly 50,000 Kenya shillings. So you will go to enjoy sex for a short time, but you will treat that condition with more than 70,000 shillings for 1 full year. I put 50,000 because you don't know how much you will spend. You understand the costs related to the treatment and many other conditions, for example, like chlamydia. Do you know that if you have that condition and then you develop an infection, you can even undergo surgery when that infection spreads to your, for example, when a lady has salpingitis, or maybe, for example, when a lady develops an infection of the ovary, the infection can go up to the ovaries, or it can, you understand, I don't want to go deeper into diseases and treatment and all that, but just know that treatment can cost you a lot in terms of money, peace of mind, and just your general well-being. So do not underestimate the burden of treating these diseases by saying that this disease came for human beings. It came for human beings, but it is with other people. Now, when it will find you, that is when you will know that it is very burdensome to treat it. And some of them you will not treat it. For example, when you get the human papilloma virus and it comes to your to your thing, I don't want to mention it because I know YouTube may demonetize this video. And then it starts bulging and becoming bigger. Now you have cancer because of HPV. How will you treat it? Is cancer treatable? No. You will get it. And people have it out here. That beautiful lady that you see telling you that I cannot date a broke man, she has that condition. That cute lady that you see, she has a lipstick and then she was walking around and then you are praising her nyash. That girl has that infection. People with this infection are not ugly people who have nothing to do in life. They are very clean people, very beautiful, presentable people who know how to talk well. Those are the people with infections. They are people you say that they are your type. You will go for these people and they will give you that infection. Now you will deal with that condition. Physically it will be draining. Financially it will be draining. Emotionally it will be draining. And if you have cancer, it will finish your life. Right? So my brother, do not say that rearing a cow is expensive and buying milk is cheaper. Kindly rear 1 cow and then drink your milk from that cow. Now, if you really suspect that it is a very bad thing to have a cow, then you can decide and then stop it. But the moment you start buying milk from different cows, my brother, you are putting yourself at risk of many infections, and we have seen many as healthcare providers. You who is out here, you can't see many, but we have seen many, and I'm advising you that kindly rear a cow. If you cannot rear a cow, please stay away from cows. Thank you for listening to me. This is Gidi Akali, and we shall meet again in another video. Peace.